Okay, let's unpack this. Imagine looking into the eyes of your beloved dog or cat and noticing something isn't quite right.
hmm
Maybe it's just vision changes you've picked up on, or perhaps even more alarming, something that looks distinctly like bleeding inside the eye itself.
Yeah, that's definitely worrying.
Seeing that can be incredibly worrying. What does it mean? Is it just an isolated problem with the eye, or could it be a sign of something bigger, something systemic happening elsewhere in their body?
It's absolutely a situation that raises concern, and you've hit on the crucial point right away. The eyes often give us insights into overall health that we might not see otherwise.
Exactly. And for this deep dive, we're focused specifically on that alarming finding retinal hemorrhage in canine and feline patients.
Right.
We've pulled together detailed veterinary source material, and our mission is to extract the most important knowledge nuggets for you. We want to help you understand what retinal hemorrhage is, why it happens,
Which is key.
how vets figure out the underlying cause, what they do about it, and most importantly, what it could mean for your pet's vision and overall health. Think of this as your shortcut to being well-informed on a complex topic.
It's definitely a condition where what you see in the eye is often just the visible part of a much larger problem, which is why, understanding those underlying causes is so essential.
Absolutely. So let's start with a fundamental question. What exactly is retinal hemorrhage?
Okay. At its core, retinal hemorrhage is bleeding that occurs within some or all of the layers of the retina.
The retina itself.
Yeah, or sometimes into the space just next to it, or even into the vitreous humor, the gel behind it. It can appear suddenly, that's acute, or it can develop slowly over time, which is chronic.
And the sources are very clear that seeing this is a significant finding, right? It's not usually just some random occurrence.
No, not usually. What's fascinating here is that, as you noted, retinal hemorrhage is almost always secondary to another underlying condition, either systemic or something else in the eye.
So finding it is a major clue.
It's a key indicator that something serious is going on. And its presence and how severe it is can definitely impact vision. It could potentially lead to partial or even complete blindness.
Wow. Suddenly or over time?
It can be either, yeah. Depends on the cause and the extent.
Okay, so it's not just that there's bleeding, but where it is in the different layers of the retina or surrounding structures.
Yeah.
The sources detail specific locations and how they look.
Yes, exactly. And the appearance during an eye exam often gives clues to the location.
Okay.
So when the bleeding is within the retinal layers themselves, it's called intraretinal hemorrhage.
Intraretinal. Got it.
And the sources describe this looking like small spots or blots. Dot and blot hemorrhages is the term. Or sometimes more linear flame-shaped hemorrhages, especially if it's tracking along the nerve fibers.
Right, so little distinct spots or streaks you might actually see on examination.
Precisely. Then there's subretinal hemorrhage.
Subretinal. Underneath.
Yeah, bleeding that happens between the retina and the leo just beneath it, the retinal pigment epithelium, or RPE. This often appears as darker, kind of elevated areas when the vet is looking, and it can actually push the retina away.
Oh, so it could cause a detachment?
Potentially, yes. It's definitely associated with retinal detachment sometimes.
So it might look like a raised dark area.
That's a good way to picture it. Moving forward, we have preretinal, or sometimes it's called subcelluloid hemorrhage.
Pre-retinal, okay.
This occurs between the retina and the vitreous gel that fills the main part of the eye.
Right.
This one is quite distinct because, gravity affects it. It often settles into a characteristic boat-shaped appearance with a flat top.
That's a very descriptive image, like a little pool of blood with a flat surface.
It really helps identify the location, yeah.
Huh?
And finally, vitreous hemorrhage.
In the vitreous itself.
Exactly, bleeding directly into the vitreous cavity. If this is significant, it can be the most visually obstructive.
Because it just fills up the space.
Right. It fills that space and can completely block the vet's view of the fundus, the back of the eye. Makes assessment much harder.
So finding any of these types of bleeding immediately signals the need to investigate further. Which brings us to the part the sources really emphasize.
Right. Here's where it gets really interesting. Figuring out why this is happening.
The underlying cause.
Yes. As we've stressed, retinal hemorrhage is almost always a symptom of another underlying condition. This is why the sources highlight that a thorough systemic workup, looking at the pet's overall health, is absolutely crucial. You can't skip it.
Okay, let's dive into those underlying causes, starting with the ones the sources point to as most common and important. Systemic diseases, right?
Leading the list of systemic causes is systemic hypertension, high blood pressure.
Oh, okay.
The sources are very clear on this. It's cited as the most common cause of acute retinal issues, particularly in older cats.
High blood pressure seems like,
Mhm.
well, maybe a surprising cause for eye bleeding to some. How does that connection work?
Well, the mechanism involves the elevated pressure damaging the small, delicate blood vessels in the retina and the choroid layer beneath it.
They're just fragile.
Very fragile. And over time, or sometimes acutely with a sudden spike in pressure, this can cause the vessels to rupture and bleed.
Okay.
The sources particularly link systemic hypertension in older cats strongly with chronic kidney disease and hyperthyroidism.
Right, I've heard that connection.
Yeah, it's very common. But they also mention associations with conditions like hyperadrenocorticism, Cushing's disease, or diabetes in either species.
And how does it usually present?
Often, a really dramatic presentation of hypertension-related retinal hemorrhage is sudden blindness, and frequently it affects both eyes.
Wow, so the very first sign you might see of chronic kidney disease or an overactive thyroid in an older cat could be sudden blindness due to bleeding in the eye.
It happens.
That really drives home the canary in the coal mine idea.
It absolutely does. It's a classic example. Another major category the sources detail is coagulopathies.
Bleeding disorders.
Bleeding disorders, exactly. Any issue with platelets, either not enough of them, which is thrombocytopenia, or they aren't functioning correctly, or problems with the clotting factors in the blood, any of those can lead to spontaneous bleeding, including into the retina.
And the sources give examples of what can cause those clotting issues, like specific diseases.
Yes, they do. Examples include things like immune-mediated thrombocytopenia, where the body attacks its own platelets,
Okay.
certain tick-borne diseases like ehrlichiosis, some cancers that affect platelet production, or deficiencies in clotting factors.
Right.
These factor issues can be inherited, like von Willebrand disease in certain breeds, Dobermans for instance, or they can be acquired. A classic example is rodenticide toxicity rat poison.
Ah, the anticoagulant ones.
Exactly, the ones that interfere with vitamin K needed for clotting, or severe liver disease because the liver makes most clotting factors.
And in those cases, you might see other signs too.
Definitely. You might see other signs of bleeding elsewhere in the body. Tiny red spots on the skin or gums called petechiae, larger bruises, ecchymoses, nosebleeds, or blood in the urine or stool.
That makes perfect sense.
Yep.
If the blood can't clot properly, any fragile vessel, including those in the eye, is vulnerable.
Precisely.
The sources also mention infections.
They do. Certain infectious diseases are listed as potential causes.
Like what?
Well, the sources specifically mention rickettsial agents like Ehrlichia, which we mentioned with platelets, and also rickettsia, which causes Rocky Mountain spotted fever.
Okay.
Various systemic mycoses, fungal infections like crypto, blasto, coccidioidomycosis, histo, some viruses like feline infectious peritonitis, FIP, which causes vasculitis, inflammation of blood vessels,
Right.
canine distemper, and even protozoal diseases like toxoplasmosis or neosporosis.
That covers a wide range of potential pathogens. A lot to think about.
It does, yeah, and the specific ones of concern can definitely vary by geographic location.
Makes sense. What about cancer?
Neoplasia, or cancer, is another cause. This could be due to tumors originating in the eye that bleed, such as lymphoma or melanoma,
Okay.
or it could be from metastatic tumors. Cancer that has spread from elsewhere in the body to the choroid layer behind the retina and then causes bleeding there.
So cancer elsewhere in the body could show up as bleeding in the eye first.
It's possible, yes. We also see inflammatory or immune-mediated diseases.
Like autoimmune issues.
Sort of, yeah, where the body's own immune system attacks blood vessels, causing vasculitis. That inflammation makes them leaky or prone to rupture. Examples include conditions like systemic lupus, erythematosus, SLE, or polyarteritis nodosa.
Okay. And they list some metabolic or endocrine issues as well, besides the thyroid link.
Diabetes mellitus is mentioned, though it's important to note something here.
Okay.
The severe proliferative form of diabetic retinopathy that leads to significant hemorrhage, which is quite common in humans with diabetes. That's actually much rarer in dogs and cats. They can get other eye changes with diabetes, but massive hemorrhages are less typical than in people.
Interesting difference.
Yeah. Another one is hyperviscosity syndrome.
Hyperviscosity,
Yeah.
thick blood.
Exactly. Where the blood becomes unusually thick or viscous. This can happen with very high levels of certain proteins, often seen in conditions like multiple myeloma or some types of lymphoma.
And the thick blood damages vessels.
Right. It doesn't flow well through the small vessels and can cause damage and leakage.
Okay, and of course toxins. We mentioned rodenticides.
Absolutely. Toxins, particularly those rodenticides containing vitamin K antagonists, are a classic example. They directly cause a severe acquired clotting disorder that leads to bleeding anywhere, including the eye.
That gives us a really comprehensive picture of the systemic issues. But the problem is happening in the eye. What about causes that originate in the eye itself? What do the sources say there?
Good point.
No.
While systemic causes are really common, local eye issues can definitely cause retinal hemorrhage too. Trauma is a straightforward one.
Makes sense. A hit to the eye.
Yeah. A direct blow or a penetrating injury to the eye can tear blood vessels in the retina or the choroid.
No.
Even less direct trauma, like choking or strangulation,
Really?
yeah, that can cause severe venous congestion, basically increased pressure in the veins in the head and eyes, leading to vessel rupture.
Wow. And the relationship with retinal detachment, you mentioned that briefly.
The sources highlight a kind of complex two-way relationship here. Hemorrhage can cause a retinal detachment, like if blood pools under the retina and pushes it away.
Okay.
Or bleeding can happen because of a detachment. For instance, if retinal vessels are torn during the detachment process itself.
So chicken and egg sometimes.
A bit, yeah. They often go hand in hand.
What about high pressure inside the eye, glaucoma?
Yep. Elevated intraocular pressure can definitely compromise blood flow and vessel integrity within the eye, potentially leading to bleeding.
Okay.
And severe inflammation inside the eye, a condition called uveitis, that can make existing vessels leaky. Or it can even stimulate the growth of fragile, abnormal new vessels. That's called neovascularization. And these new vessels are highly prone to bleeding.
Ah, okay. The sources also mention some conditions pets are born with, right? Congenital issues.
Yes, congenital anomalies. There are specific inherited eye conditions involving abnormal development, particularly of the blood vessels, that can lead to hemorrhage.
Which ones?
The sources list conditions like collie eye anomaly, seen in collies and Shelties and related breeds,
Yeah.
and various forms of retinal dysplasia, which is abnormal retinal development found in breeds like Labradors, Scillyhams, Bedlington Terriers, Springer Spaniels, miniature Schnauzers.
Quite a few breeds there.
Yeah. Merle ocular dysgenesis in Australian Shepherds is another example associated with the Merle coat pattern.
And these show up early.
Yes, these are present from birth, and signs, including potential bleeding, are often seen in very young puppies, typically around 5 to 7 weeks old when the eyes are developing. They're generally suspected to be inherited, often autosomal recessive.
So breed and age can provide really important clues for the vet.
Absolutely. Key pieces of the puzzle. And finally, though it's less common, hemorrhage can occur as a post-surgical complication after certain eye procedures, like cataract removal.
Okay, that is a really extensive list of potential causes. Systemic, ocular, congenital.
Wow. So moving from why it happens to what you, the listener, might actually see or what the vet might find, what are the key signs?
Well, sometimes, honestly, with very small hemorrhages that are found incidentally during a routine exam,
Like a checkup.
yeah, the owner might not have noticed anything at all.
Okay, but usually there's a noticeable sign if it's more significant.
Often, yes. The most common historical finding reported by owners is vision loss.
How would they notice that?
It might manifest as the pet suddenly bumping into furniture, being hesitant on stairs, maybe having trouble navigating familiar surroundings, especially in lower light conditions.
That makes sense if the bleeding is blocking their view or damaging the retina. What might a vet see during a physical or initial exam? Well, on a general physical exam, depending on the underlying cause, you might actually see visible blood in the anterior chamber of the eye, the front part between the cornea and iris. That's called hyphema.
Okay, blood in the front.
Yeah. Then, on looking into the eye, you might not see the fundus clearly. Instead, the pupil could look kind of whitish, which is called leukocoria.
Whitish pupil.
Maybe with a reddish tint behind the lens if it's blood back there. If vision loss is significant, the vet will notice an absence of the menace response, that blink reflex when a hand moves quickly towards the eye.
Right.
And importantly, if the cause is a systemic bleeding disorder, you might see those other signs of bleeding elsewhere in the body that we mentioned earlier. The petechia, bruising, maybe nosebleeds.
So the exam isn't just about the eye, it's really about looking for those systemic clues too.
Exactly, it has to be. And then, on a specific ophthalmic exam, using the special lights and lenses, the fundic exam, the vet sees the specific appearance of the hemorrhage based on its location, just like we described.
The dots, blots, flame shapes.
Right, or the dark elevated areas, the boat shapes, or just a diffuse haze if the vitreous is filled with blood. They'll also look for associated signs like swelling of the retina, which is edema, any retinal detachment, or abnormal looking blood vessels.
Uh-huh.
And as you noted earlier, signs of the underlying systemic disease like increased thirst and urination, or weight loss, or lethargy might be present and are really important parts of the history.
Okay, with so many potential causes and varying signs, how do vets figure out precisely what's going on? What does that diagnostic process look like? It sounds complicated.
It can be, yeah. This
Yeah.
is where the sources strongly emphasize the need for a rapid and systematic approach. The goal is always to identify that underlying cause.
Right.
You cannot effectively treat the hemorrhage long term without addressing what's causing it in the first place.
Right. Treat the root cause, not just the symptom in the eye. So
Mm.
it starts with a thorough eye exam.
Yes, a detailed ophthalmic examination is the essential first step. This involves getting a complete history from the owner, assessing vision using tests like the Menace response and maybe a cotton ball tracking test,
Okay.
evaluation of pupillary light reflexes, and that crucial fundic exam using specialized equipment, direct and indirect ophthalmoscopy to visualize the back of the eye.
But you said sometimes you can't see back there.
Exactly. As we discussed, significant hemorrhage, especially in the vitreous or other issues like severe cataracts or inflammation, can completely obscure the view.
So what happens then when the vet can't see the back of the eye?
This is where the sources highlight the crucial role of ocular ultrasound, specifically a B-scan ultrasound.
Okay, ultrasound for the eye.
Yes. When the view is blocked by hemorrhage or cataracts or hyphema, ultrasound allows the vet to essentially look inside the globe with sound waves. They can evaluate the location and extent of the bleeding, check if the retina is attached or detached, and look for any masses or tumors within the eye.
So it's the key tool when visualization is poor.
It's absolutely indispensable in those situations.
Okay, so ultrasound is the workaround for seeing inside.
Yeah.
And the sources stress looking at the whole animal, right? Not just the eye test.
Absolutely. The sources are very clear that systemic diagnostics are critical for identifying the underlying cause. This is basically non-negotiable in every case of retinal hemorrhage.
Got it.
High on that list, mandated for virtually all patients with retinal hemorrhage, particularly older cats and any older animal really, is blood pressure measurement.
Check the blood pressure first.
Always. Using a Doppler unit is the preferred method for accuracy in pets.
So blood pressure check is a required test. What else is standard? What other blood tests?
A complete blood count, a CBC, is essential. That checks for anemia, signs of systemic infection or inflammation, and critically, the platelet count. Low platelets are a common cause of bleeding.
Okay, CBC.
Then a serum chemistry panel. This helps assess organ function, especially the kidneys and liver, and checks blood glucose for diabetes. The sources specifically note that high kidney values, BUN and creatinine, and protein in the urine are often seen in cats with hypertension linked to kidney disease.
Right, that connection again.
Yeah, and urinalysis itself provides important information about kidney function and can show infection or protein loss.
And if a bleeding disorder is suspected from the history or the CBC?
Then a coagulation profile is essential. If there's suspicion of a bleeding disorder or if a low platelet count is found on the CBC, you need these tests.
Like PT, PTT.
Exactly. Tests like PT and APTT, which look at how quickly blood clots through different internal pathways. And sometimes a buccal mucosal bleeding time, or BMBT, which assesses how well the platelets are actually functioning to form a plug.
Okay. What about testing for infections or other systemic issues like Cushing's?
Yes. Infectious disease testing specific tests like serology or PCR are selected based on the pet signs, their lifestyle, where they live, basically what diseases are common in that area. So you might test for Ehrlichia, Toxoplasma, or Phip titers in cats, for example.
Tailored testing.
Exactly. If the systemic signs suggest an endocrine issue, then endocrine testing might be done, like thyroid levels for cats, or ACTH stimulation tests, or low-dose DEX suppression tests for dogs suspected of having hyperadrenocorticism, Cushing's disease.
Right.
And if that hyperviscosity syndrome, the thick blood, is suspected based on protein levels, then a serum protein electrophoresis is done to specifically measure the different types of proteins in the blood.
Do they use general imaging like x-rays or ultrasound elsewhere in the body too? not just the eye.
Yes, absolutely. Imaging like chest x-rays or abdominal ultrasound can be really important tools to screen for systemic issues, things like searching for hidden cancer, metastatic disease, or organ abnormalities that could be the underlying cause of the eye bleeding.
So looking for the primary problem. And there's a test to assess the retina's actual function, right? Not just if you can see it.
Yes, that's the electroretinography, or ERG.
ERG.
It measures the electrical activity of the retina in response to light flashes. It basically assesses its overall function.
Why is that useful here?
It's particularly useful if there's severe vision loss and you need to know if the retina itself is still working, even if there's blood in the way. It helps rule out a primary retinal degeneration that might be causing the vision loss unrelated to the hemorrhage.
So it tells you if the retina could see if the blood cleared.
In essence, yes. An extinguished ERG, meaning no electrical response, even if you can see some hemorrhage, indicates profound, likely irreversible retinal dysfunction. The prognosis for vision is very poor then.
Got it. That's a key prognostic indicator. And just briefly, are there things that might look like retinal hemorrhage to an owner, or maybe even initially to a vet, that turn out to be something else?
Yes, it's important for the vet to consider differential diagnoses. Sometimes, in pets with light-colored fundus backgrounds, you can easily see the normal red pattern of blood vessels in the choroid layer beneath the retina.
Ah, so it looks red, but it's normal vessels.
Right, the blood is contained within the normal vessels, not bleeding out. Also, other kinds of opacities in the vitreous, maybe from inflammation or cellular debris, can obscure the view, but they usually don't have that distinct reddish appearance of hemorrhage itself. Careful examination usually differentiates them.
Okay, so a thorough workup is definitely needed to pinpoint the cause. Once that's identified, or while it's being identified, how do vets manage and treat this condition? What's the approach?
Well, the absolute primary goal, and the sources repeat this often, is always to treat the underlying cause.
Right, back to that again.
You can manage the eye signs, you can put drops in, but if you don't fix what's making it bleed in the first place, the problem will just persist or likely recur.
So treating the systemic disease is the main focus, the #1 priority.
Exactly. That means specific treatments tailored to the diagnosis. So, antihypertensive therapy.
For the high blood pressure.
Right. Often with drugs like amlodipine, especially for cats, or maybe ACE inhibitors like enalapril, or ARBs like telmisartan for dogs. Getting that blood pressure under control and keeping it there requires careful monitoring.
Okay.
If it's a coagulopathy, a bleeding disorder, the treatment varies widely depending on the cause.
Right, because there were lots of causes.
Exactly. It might be immunosuppressants like steroids for immune-mediated thrombocytopenia. It might be specific antibiotics like doxycycline for ehrlichiosis. It's vitamin K1 for rodenticide toxicity, possibly even plasma transfusions for severe clotting factor deficiencies.
Very specific treatments.
Very specific. Infections are treated with the appropriate antimicrobials, antifungals, or antiparasitics. Neoplasia, cancer might involve chemotherapy, radiation, or surgery, depending on the type and location. And systemic immunosuppressants like corticosteroids or maybe azathioprine might be used for those immune-mediated vasculitis conditions.
Okay, that covers the systemic side. What about specific treatments for the eye itself, while the underlying cause is being addressed?
Yeah, there's definitely ocular management too. This often includes things like anti-inflammatory eye drops or sometimes oral medications, topical steroids like prednisolone acetate, or maybe topical or oral NSAIDs, especially if there's associated uveitis, that inflammation inside the eye.
To calm down the eye inflammation.
Exactly. Mydriatic drops like atropine are often used. These dilate the pupil.
Why dilate it?
It helps ease pain from ciliary muscle spasms, which often accompany uveitis. It also makes it easier for the vet to examine the back of the eye during follow-up checks, and sometimes it can help prevent the iris sticking to the lens.
Okay.
And if the bleeding or inflammation leads to secondary glaucoma, high pressure inside the eye, then medications specifically to lower the eye pressure are necessary.
And does the blood just eventually go away on its own? Does the body clean it up?
Yes, for many hemorrhages, allowing time for the blood to naturally reabsorb is a necessary part of the process. The body's own cleanup crews, macrophages, will gradually break down and remove the blood cells.
How long does that take?
It really varies. It can take quite a while. It could be weeks to several months, depending heavily on the amount of blood. Its exact location, vitreous hemorrhage, takes longer to clear than some others, and of course, how well the underlying cause is controlled.
So patience is needed.
Yeah.
Are there surgical options mentioned in the sources
Hmm.
for the eye itself?
Yes, but surgical intervention is quite specialized and typically involves referral to a veterinary ophthalmologist.
Okay.
A procedure called a vitrectomy might be considered.
Vitrectomy, removing the vitreous.
Essentially, yes. Removing the blood-filled vitreous gel. This is usually reserved for severe vitreous hemorrhage that isn't clearing on its own after a reasonable time and is significantly impacting vision or risking secondary complications.
Complications like what?
Things like ghost cell glaucoma, where degenerated red blood cells clog the eye's drainage system, or
Mhm.
tractional retinal detachment, where membranes forming and the bloody vitreous pull on the retina.
Okay.
Also, if the hemorrhage caused a significant retinal detachment initially, retinal reattachment surgery might be attempted, but really only if the retina is still thought to be potentially functional based on tests like the ERG and ultrasound. These are complex surgeries.
Sounds like it. What about supportive care for the pet during recovery? Anything owners can do?
Supportive care can be very important. Strict cage rest is often recommended, especially for cases due to trauma or severe bleeding disorders, to minimize the chance of further bleeding or rebleeding.
Keep them quiet.
Yeah, reduce activity. And environmental adaptations are crucial for pets experiencing significant or permanent vision loss, keeping furniture in place, blocking off stairs, ensuring easy access to food and water, helping them adapt.
Right.
Client education is also heavily emphasized in the sources. Having open and honest discussions about the prognosis, the potential for blindness, living with a potentially blind pet.
That must be tough.
It can be. And sadly, in some situations, like severe congenital anomalies found in very young puppies of specific breeds where there's no hope for vision or quality of life, the difficult possibility of euthanasia might need to be discussed.
Okay.
For pets affected only in one eye, they can often function very well as pets, adapting quite readily. But the sources stress they should not be bred, especially if it's a suspected inherited condition. That's important information for owners of purebred animals.
Good point. And referral to a specialist sounds like a common step, especially for the complex cases.
It often is, yes. Particularly for those advanced diagnostics like ocular ultrasound and ERG, and certainly for considering or performing any surgical management like vitrectomy or retinal reattachment. The general practitioner plays a huge role in the initial diagnosis and systemic workup, but the ophthalmologist brings specialized skills for the eye itself.
Okay. So, looking at the bigger picture now, what's the outlook? What's the prognosis for a pet diagnosed with retinal hemorrhage? Does the vision usually come back?
Well, the prognosis for vision is hygiocally Y variable. The sources are very clear on this. It really depends heavily on several key factors.
Like the underlying cause, I assume that's number one.
Absolutely. The underlying cause is a major determinant. Hemorrhages due to, say, well-controlled systemic hypertension, where you get the pressure down quickly, or maybe from an acute, mild trauma that heals, those often have a better prognosis for vision recovery compared to those caused by chronic, difficult-to-treat conditions like uncontrolled kidney failure causing ongoing hypertension, or widespread systemic cancer or severe inherited defects.
Makes sense. And the bleeding itself, does the amount or location matter for prognosis?
Yes, definitely. The location and extent of the hemorrhage matter a lot. Small intraretinal hemorrhages, those little dots and blots within the retina, they often resolve completely with no permanent vision loss.
Okay, that's good news.
Yeah. But larger peretinal or especially subretinal hemorrhages, the ones under the retina, particularly if they lead to a retinal detachment, they carry a much more guarded prognosis for vision.
And the vitreous hemorrhage.
Vitreous hemorrhage can take a very long time to clear. If it persists, it can cause permanent vision loss due to lack of stimulation to the retina or because of those complications we mentioned like glaucoma or tractional detachment. The duration of the hemorrhage is also a factor. The longer blood is in contact with the delicate retinal tissue, the more potential for damage.
Does that ERG test, the retinal function test, help predict the outcome too?
Yes, absolutely. The status of retinal function as assessed by ERG is very important prognostically. If the ERG is completely flat, extinguished, it indicates severe, likely irreversible retinal damage, regardless of the hemorrhage clearing. Vision recovery is unlikely then.
But if the ERG is okay,
A more normal ERG suggests the retina itself is still functional, and visual recovery is definitely possible, maybe even likely, once the bleeding clears and the underlying cause is managed. And of course, the response to treatment of that underlying systemic cause is key, both for allowing the eye to heal and, crucially, for preventing recurrence.
So follow-up is definitely needed then to see if it's improving and check for problems.
Absolutely. Repeated monitoring the eyes is necessary. The vet needs to track the reabsorption of the blood, assess the retinal status with ophthalmoscopy, maybe repeat ultrasounds or ERGs.
And look for complications.
Exactly. While smaller hemorrhages might absorb relatively uneventfully over weeks to months, larger or repeated hemorrhages can lead to significant complications like permanent scarring, the formation of fibrous membranes on the retinal surface or in the vitreous.
Which can cause problems.
Yes, those membranes can contract and cause tractional retinal detachment, where the scar tissue literally pulls the retina away. That's very serious.
And the most serious potential outcomes overall.
Well, the worst-case scenarios include complete irreversible retinal detachment, permanent blindness or severely impaired vision, chronic ongoing inflammation within the eye, uveitis, and secondary glaucoma, which can be painful and also lead to blindness.
So it can range from full recovery to permanent blindness.
Pretty much. The sources reiterate that while many small, incidentally found hemorrhages heal without issue, those linked to significant systemic disease or major ocular malformations are much more serious, with prognosis that's often guarded or uncertain, at least initially.
Okay. Are there any notable differences between dogs and cats when it comes to retinal hemorrhage that the sources highlighted? Do we see different causes more often?
While many causes are similar across both species, there are some key distinctions worth mentioning. As we've touched on a couple of times, systemic hypertension causing acute retinal hemorrhage and detachment is particularly prominent and a common emergency presentation in older cats.
That kidney disease hyperthyroid link.
Exactly. Strongly linked to chronic kidney disease and hyperthyroidism. This specific scenario, sudden blindness from hypertension, is seen less frequently as that kind of acute, dramatic, primary cause of blindness in dogs, although hypertension certainly can occur in dogs too and cause issues.
Okay, so high blood pressure blindness in older cats is a big one to remember, a really key association.
It's a classic scenario the sources emphasize, definitely. The prevalence of specific infectious causes can also vary between species. Dogs and cats get different bugs sometimes based on what they're exposed to and their natural susceptibility.
Makes sense.
Inherited bleeding disorders that might cause retinal hemorrhage, like von Willebrand's, are seen more commonly in certain dog breeds than generally in cats.
Okay.
And as we touched on earlier regarding diabetes, that severe proliferative diabetic retinopathy leading to significant bleeding, which is so common in human diabetics,
Yeah.
that's notably much, much rarer in both dogs and cats. Their diabetic eye changes tend to be different.
Interesting distinctions. They definitely guide the diagnostic thinking, I imagine.
They absolutely help narrow down the list of likely suspects based on the patient's species, age, breed, and history. It's all part of the puzzle.
So what's really fascinating here, wrapping things up, is how the eye, specifically the retina, really can act like that canary in the coal mine.
It's a great analogy.
It often shows signs of serious illness happening elsewhere in the body, sometimes, as you said, before any other signs are even apparent.
Right.
This deep dive has clearly shown us that while seeing blood in your pet's eye is certainly alarming, it's absolutely crucial to look beyond the eye itself to find the true underlying cause.
You have to.
Understanding that intricate connection between systemic health and eye health is really the key to getting to the bottom of it and figuring out how best to help your pet.
It's a powerful illustration of how interconnected the body systems are, isn't it? And it truly underscores the necessity of that comprehensive diagnostic workup whenever retinal hemorrhage is discovered. Don't just treat the eye.
Absolutely. This raises an important question, I think, for you, the listener, to consider. Given that something like high blood pressure or maybe a clotting disorder could potentially be quietly affecting multiple organs way before showing dramatic signs like eye bleeding.
Silently progressing.
Yeah. How much could proactively monitoring for these underlying conditions, especially as our pets get older, or maybe if they have conditions known to predispose them, like kidney disease, how much could that help protect not just their vision, but potentially their overall well-being, their organ health in the long run?
That's a really good point. Early detection makes a huge difference.
Dumped them all over for you.